Good afternoon, everyone. This is Christine at Health Current. Thank you for your patience. We are going to get today's webinar underway today. Controlled Substance Prescription Monitoring Program. Lynn Curtis is the Marketing Specialist with the Arizona State Board of Pharmacy. He will be walking us through all the fun and exciting things about the Controlled Prescription Monitoring Program today. So thank you, Lynn, for joining us. This after, a little bit later in today's presentation, Dr. First will be doing a demo. Eric will we'll turn the controls over to Eric from Dr. First. Thank you again, Lynn, for joining us, and I will turn the presentation over to you.
Christine, thank you so much for having me, and a couple little hiccups that we got through, so we appreciate that very much. Again, my name is Lynn, and thank you for joining me today. I know that you're all very busy and taking the time out of your day, especially at this time of day. You're probably munching down on hopefully a healthy lunch. What I want to do is today we're going to talk a little bit about the PMP, of course, the patient report and when and how to use the report. And then what I want to do is kind of expand a little bit and talk about some of the updates that have happened in the last couple of years to the statutes, not only around the use of the PMP, but also those that affect prescribers and pharmacists as well. And then there are some additional tools and resources that came out of some legislation after from the last couple of years that I want to introduce to prescribers especially. Hopefully these will be useful for you going down the road. So let's go ahead and get started by doing a quick quiz about the PMP. And what I'll have you do is I'll ask a question, and then we'll give you just a moment to respond. Christine will kind of give us a couple of the answers, and then I'll kind of give you the right answer. So Christine, if we can go to the first question. And basically the first question is, how long has the PMP been active in Arizona? So how long has the Arizona PMP been around? If you would please, in the chat, just give me your best guess.
I don't know, Lynn, I think you might have stumped us.
Don't be afraid. Don't be shy. The PMP has actually been around since 2008. So it's been around almost 11 years.
We had one guess at 2006.
Oh,
very close.
Well done. Well done. That's actually, usually people say just a couple of years, but it's been around for that long. So the next question is, in last year, 2018, how many queries happened or were put to the Arizona PMP? And go ahead and give me your best guess. Again, don't be shy.
1 million.
1 million, okay. Any other guesses? And usually how this plays out, somebody will say 1,000,001, like the Price is Right. Last year, there was actually 8.9 million queries to the Arizona PMP, and that astonishes a lot of people. A lot of people. So it was used quite a bit, which is what we like. One last question, and then we'll move on. How many states are connected to the Arizona PMP? And I'll give you a little bit of a clue. Every state has some form of a PMP in it. So go ahead and give me your best guess.
43.
43, okay.
40.
40, okay.
Folks are chiming in.
Good.
All 50?
We're warming up a little bit. We're warming up. Good. Okay, the answer is, at the moment, 35 plus the military health services, which we count sort of a separate state. And the reason why we are not connected to all 50, which we would like to be at some point in time, is statute sort of mandates that we can give out certain information and not give out certain information. And so if the statutes line up, then we're able to connect to another state. The big state that Arizona is not connected to right now is California, because they have very specific statutes regarding their PMP. So anyway, very good. I hope that kind of broke the ice a little bit, and we can kind of go on. Let's go and talk about what the PMP is. Now, officially it's called the Controlled Substances Prescription Monitoring Program, but you might hear it, you know, the CSPMP, the PDPMP. We refer to it as the PMP, and that's what I will use in the next little while. So it is a database that tracks when controlled substances are dispensed. And that's the reason why I work for the Board of Pharmacy. It's because it's the pharmacists who actually upload the information, and that's what goes into the PMP. And of course, it is only controlled substances. The primary use of the tool is to help prescribers and pharmacists make the best healthcare decisions for their patients. And it also does a couple other things too that we'll talk about in a little bit, but that is the main reason why we have the PMP, is to help you out as prescribers and dispensers. So the main report of the PMP is the Patient Utilization Report. This is what you would query. Those 8.9 million. A good chunk of those is this report. In order to query a PMP report, you need to have the patient's first name, last name, and a date of birth. That is the minimum. You can also do a partial name search if need be, and you can also do a multiple name search if you need to as well. You'll notice on this slide that the top section actually has information regarding the patient. You'll see variations of the patient's name. You might have a Len, Lenny, and Leonard. You will also note that there are addresses associated with the patients, and this is all one patient. It's just that different information comes in for on the different prescriptions, and the program will match those up the best that it can. The next section down is the summary section, and there you'll see a total of prescriptions that are on the report that you pulled. You'll also see total prescribers and total pharmacies that are involved in the report. Now, a default report is for the past year from the date that you pull the report, but you can actually put in a longer search if you want. The next section is actually the prescription section, and this is the meat of the report. This is where we get down to the information that you're going to need when you are prescribing or dispensing controlled substance. I just want to kind of review quickly, because I can't really know how much you know or don't know about the tool. Hopefully you know a lot about the tool, but let me just kind of go through some of the columns that we have here. You have the field date, and then you have the ID column, and that actually corresponds back to that first section where you can tell what is the name and address on the prescription itself. Why this is important? Well, let's say that somebody has a life event where they change a name. It's the same patient, but it might come up as a different record, so that will help you in that regard as well. You have the date that the prescription is written. You have the drug. You have the quantity of the initial prescription. You have the length of days that was prescribed for. You have the prescriber, which is important. You have the prescription number. You have the pharmacy, and then you have the refills. And typically on a real report, you would have how many refills were a part of the initial prescription, and then how many have been filled. And then, of course, some other information that we have there. Let's go ahead and go on to the next section as I take a sip of water. The last two sections give you information about who prescribed and who dispensed the prescriptions. And why is this important? If you have a question about a prescription or something on the report, this gives you information where you can contact the medical professional who helped with that prescription to get information on the situation around it, why it was prescribed and the way it was prescribed. Okay, so that is the patient utilization report. Let's go ahead and go on and talk about, probably not what you want to hear during a lunch hour, but maybe some statutes and law. So as most of you probably know, there is an opioid epidemic epidemic out there, and Arizona a few years ago was being hit pretty hard, and is still being hit pretty hard with this. In response to that, Governor Ducey in January 2018 signed the Arizona Opioid Epidemic Act. So what were some of the goals of this act? Well, it was to increase patient and public awareness of opioid use. They wanted to improve prescribing and dispensing practices. They wanted to reduce illicit acquisition and diversion of opioids, improve access to treatment, and the most important goal of all was to reduce opioid deaths. So there were, of course, some statutes and some resources that came out of this, and I want to talk about those now. The first thing we want to talk about is who needs to be registered for the PMP. And if you are a prescriber and you have a valid license from a state licensing board and you have a valid DEA number, registration number, you must be registered with the PMP. Even if you are not prescribing controlled substances, you still must be registered. Registration is free. Registration, once you're registered, you are registered. It's valid until either you give up your license or you give up your DEA number. So there's really no reason why you should not be registered. As a pharmacist, if you have a valid license from a state board of pharmacy and you are employed at a facility with a valid DEA number, then you must be registered. So again, the difference there is if you're a prescriber, you have a personal DEA number. If you're a pharmacist, you would register using the facility's DEA number. So it's very important to keep that DEA number updated in your account of the PMP. So we know that prescribers and pharmacists have access to the PMP. Well, who else does? Well, there are delegates, and I'm sure there's some of you that use delegates, and we'll talk about delegates in a little bit more in depth a little bit later. The licensing boards have access, as do the medical examiners. Now, there is a difference in this list on the slide. Those on the left have direct access to the PMP information. And what I mean by that is they can go in, if they have a valid reason, which we'll talk about in a little bit, they can access reports on the PMP. Now, the folks on the right, law enforcement or criminal justice agencies, the medical fraud investigators, the attorneys, and individual patients, they have indirect access. And what I mean by that is if you are part of a law enforcement or criminal agency and you need access to the PMP, you can go in, you have to have your own account, you request a report, but we won't release that report until you've given us a signed affidavit, a valid affidavit that matches the search criteria that you used for your report. Once we have that, then we're able to release it to you. Attorneys, we do not accept subpoenas, but we do honor court orders. And again, we follow the court order. It's got to be exactly right with the name of the patient, the time frame, and then we release that. Now, as a citizen of the state of Arizona, you do have access to your PMP report. On our website, there is a form that you would fill out, and then you would have that form notarized. You would send that form in with a copy of a valid government-issued ID. We would release those to you, those records to you. Okay, so we know who has access now. Let's go ahead and talk about when we need to pull the report, and this, again, is by statute. So if you're a prescriber, before you prescribe an opioid or benzodiazepine, you need to pull a patient utilization report. Okay? It must include the preceding 12 months, which is the default length of the report, and you must pull it for every new initial course of treatment. And if that treatment turns into something long-term, you have to pull a new report every 3 months during that treatment. Okay? But more importantly, prescribing an opioid or benzodiazepine, you must, mandated by statute, pull a report. Now, there are some exemptions to having to review a report. And of course, if you're treating a patient with a cancer diagnosis, a patient with a traumatic injury, somebody who's in hospice or palliative or end-of-life care or are in a skilled nursing facility, and also if your patient is in a medication-assisted treatment program, then you are exempt from having to review the report. So let's talk about when pharmacists have to pull a report. So a pharmacist must pull a report before dispensing a Schedule II controlled substance. Now, what's important about that is this is a little bit wider net than is required of a prescriber. So prescribers out there, if you get a call from a pharmacist who has a question about a patient, just remember that they're sort of using, or they are using their corresponding responsibility. They might have a question, and just take the time to kind of talk it out with them because their net's a little bit wider. It's all for the benefit of the patient itself. And again, it must be for the last 12 months, which is the default, and for a new course of treatment. So there are appropriate uses and, of course, inappropriate uses when we are using the PMP. And probably the best way to know if you're using the PMP correctly is if you have a medical professional to patient relationship, then that's an appropriate use. Okay, that is the link. That's when you can use it. Or if it's part of an open investigation, so law enforcement, Medicaid investigator, licensing boards, only if it's part of open investigation. Okay? There are also some other reports that can be pulled beyond the patient utilization report, and those are more specifically for prescribers that we'll talk about in a little bit. They do have access to them. So when is it not important? Well, it's fairly cut and dry, but if it's for non-treatment or an evaluation purpose, by statute, you are supposed to not look up anybody in the PMP, and that includes curiosity. Your daughter's dating a young man. You want to make sure if he's up to snuff with your high standards. You cannot go in and look up his report. We've had people come to us asking if they could use it for employment screening. Big no-no. You can't use that. Now, what is the punishment if you do? Well, it is a Class 6 felony. So just keep that in mind. It is, this information should be kept in a professional manner, and we know that you will. So we talked a lot about the things you do and don't have to do with the PMP. Let's talk about some of the advantages to using the PMP. And of course, first and foremost, and I've said this before and I'll say it again, it does assist with appropriately prescribing and dispensing. And as we have talked to the people that we work with throughout the state, it is becoming more of a best practice or even a standard of care in some situations. And what we tell people is, you know, it's free to use. We're trying to make it as easy to use as much as possible. It's there, use it. Even if you don't have to because of statute, still use it. We've also seen that it does help with identifying and deterring and preventing abuse and diversion of drugs, and we've seen that. And for you prescribers out there, on a personal note, it does safeguard your DEA number. There is a report that you can run. It's called MyRx. That will give you a list of all prescriptions that were dispensed using your DEA number. And I would say probably maybe once or twice, maybe 3 times a month, we'll get a call from a prescriber who reviewed this list. They found a patient that they weren't aware of and had, of course, they wanted to know if their DEA number was still safe or not. In that situation, what you would do is look at the report, call the pharmacy. Most of the times it's the pharmacy who uploads these. Most of the time it's just an error on their part. They fix it, then you're good to go. But in some situations, it's not, your DEA has been compromised, then we ask you to reach out to your local law enforcement. They'll know how to take care of you. Okay, so we talked about the laws when it comes to using the PMP. There were also some other statutes that came into effect around prescribing. So I just want to kind of review those really quick. Now, these prescribing limits that I'm talking about, these are only for Schedule II opioids. And so for an initial prescription for a Schedule II opioid, it can be no more than a 5-day supply. If it's after a surgical procedure, it can be no more than a 14-day supply. And what we have found is that you prescribers out there are taking this to heart, and there has been over a 50% decrease in prescriptions that are longer than that 5-day supply for the initial prescription is what we like to see. There's also another limit, and that is MMEs, or morphine milligram equivalents. I'm not in the medical profession, so I will talk in layman terms. This is really the strength of the medication. The daily MME limit for Schedule II opioids is 90 MMEs per day. If you feel, and this is your professional judgment, that it should be over 90 MMEs per day, then you must consult, and this is mandated by statute, you must consult with a board-certified pain specialist. If you are a board-certified pain specialist, you don't have to consult with another board-certified pain specialist. If you do feel that the greater than 90 MME dosage, per day dosage must be used, you must also prescribe an opioid antagonist, or like a naloxone prescription to give to the patient when they leave. And really what it all comes down to is, and I'm going to read this, but good medical practice is really prescribing opioids only when necessary and the lowest effective dose for the shortest duration required. Okay, there are some exemptions to the prescribing limits, and these are going to look somewhat familiar. We just need to remember that these new mandates were put into place not to keep needed medications from patients who are dealing with chronic pain or are maybe in a medication-assisted treatment program. And what I've learned in my short time working with this team is that, you know, the laws do change every year, and hopefully they get better for for the public, for the patient, and I believe that they are. So there's one situation I want to talk about now that causes a little bit of confusion for the number of people who probably do it, but this is prescribers who dispense controlled substances from their office, and there are some updates to the statutes that involve you. The first one is that you may no longer dispense Schedule II opioids from your office unless you are in a medication-assisted treatment program. Also, if you do dispense the controlled substances from your office, you are required, like the pharmacists have to do, to report daily what has been dispensed. And if you have a day where you do not dispense any controlled substances, you still have to report a 0. So keep that in mind, that you do have to have an account with the clearinghouse, and you do have to report. Okay? One other thing before I move on with that is we do see sometimes where people will get administering kind of confused with dispensing. The best way to say that is you would administer, maybe you would inject a medication into a patient, a controlled substance into a patient. That's administered. You do not have to report that. But if you were to fill a prescription to a patient in your office and it was in pill form and they left the office, that is dispensing. So that's the difference there.
Do you have the website that folks can check their own RX numbers? Is that part of this PowerPoint presentation, or is that something we can send out following it? The MyRx report is actually in the PMP program itself. You will have I'll show you not the exact where it's at, but my email address will be at the end, and if you want that, it is just one of the reports that you can pull up. It's very valuable. It's free. We recommend you check it regularly. You'll see my email address. If you want specific instructions to get to that, I will show you. And we also have a video, too, that they can use to get to it as well for training. Wonderful.
So, great question. Thank you. Okay, so the reason why I'm here is because, and even though it is mandated by statute to use the PMP, we're still having quite a few of our medical professionals who are not. And so we know you're busy, and that's probably one of the biggest, probably one of our biggest concerns that we get from the users is that, oh, it's just kind of clunky to use. You have to, go to another website. You have to log in. It times out. So we have been working to make it as easy as possible. And probably the biggest program that we've introduced, or the biggest thing that we've introduced to be able to mitigate that impact to your workflow is integration. And really integration is, it takes the PMP information and it will integrate it, or you can actually access it directly from either your electronic health record or your pharmacy software system. It's a button in there, as opposed to going out and logging in and that type of stuff. I've never seen it used in action, but what I'm assuming is that when you click the button, the report request comes up. It is probably pre-populated with your patient's information. All you would have to do is probably check the, if you want to check other states, submit it, and then you would have the results. So very big time saver. And most of the big players in the entities in the state are integrated, so we are really excited about that. This next slide is just kind of just gives you an idea of just how much it will save with the time and the workflow, so we can kind of go past that. There's a couple of things that I want you to know about integration. Integration is not mandatory. People, especially now with the hot topic being EPCS, or electronic prescribing of controlled substances, that is different than integration. So integration is not mandatory, and the PMP Aware platform that you log into on the web will still be available if you choose not to be integrated. But if you're not integrated yet and you want to look and see if it will work for you, we do have a very in-depth integration web page that can be found on the CSPMP website. There is a procedure you have to follow, and if you look at the slide, you kind of see the procedures there. There's forms that you have to fill out. We sign them, then we get you connected with the vendor that will take care of that, and they'll work with your EHR or your pharmacy software vendor. So it is a little bit of a process, but it is well worth it when it comes to saving time and money. One other thing that you could do if you wanted to save time in your busy work schedule is actually set up delegates. And delegates, I'm sure some of you are using delegates right now, but a delegate is somebody in your office that can pull the patient utilization reports for you. They have to have their own account. So if you have a medical assistant, or if you have somebody who is using your account to pull the PMP information, they're breaking the law, and so are you. They have to have their own account. And again, it's free. You set it up. It's not a big deal. If you, once it's set up, they would choose you as, it's called the supervisor in the program. You would either approve or reject their request to become your delegate. And what's important about that is two things. Number one, ultimately you are responsible for how they access the information. So you want to make sure that you watch what they do, and you can see what they look up. And number two, once they leave your practice or maybe move on to another pharmacy, you need to make sure that you reject their delegate access to your account, so that you're not responsible for that. Okay, so we are almost done here. Thank you for hanging in there with me. So ultimately, the PMP is a value to our patients. And we believe very strongly that even if you're not required to use the PMP, it's just good medical practice to do so. We've seen a decrease in overprescribing, doctor shopping, and illegal prescribing of prescription drugs because the PMP is being used more and more. But we do know that deaths regarding opioid overdose continue to rise. So we know that the PMP, it's not the silver bullet. It's not going to make it all go away, but it is a valuable tool in your arsenal when it comes to fighting the opioid epidemic. But there are some additional resources that you have available that I want to talk about really quick. The first one is the OR line, or the Arizona Opioid Assistance and Referral Line. Now, this is a free service to medical professionals and to the public as well. There are experts that man these phones, and they can provide real-time patient-specific consultation. They can assist with safe prescribing limits. They can identify dangerous drug combinations. But probably the most important thing they can do is if you are dealing with somebody who you think is having maybe a problem with opioids, is they can provide a warm referral to a statewide treatment center, which is valuable. And again, this is available 24 hours to medical professionals and to the public. The second thing I wanted just to remind you is the naloxone access, the standing order that Dr. Chris from the Director of Health Services issued. And basically, this is a prescription. Anybody in the public can go to a legal licensed pharmacist and they can get naloxone. And what we found is that when there's naloxone available and there's education on how to use it, lives are saved. So that's something that's available as well. The last thing I want to talk about is, and this is for prescribers mainly, is that there is, last year there was an updated prescriber guideline. What these guidelines do is they just provide information that help you kind of make decisions for treatment for acute pain and chronic pain. But they also have risk mitigation recommendations. And one of those recommendations is to use the PMP. And again, this is something that you can have with you that you can reference if you have any questions about when you're dealing with opioids and controlled substances and that type of stuff. You can download a PDF copy from the Department of Health Services website, and you can also order hard copies as well if need be. Okay, so I've talked a lot about a lot of things at a fairly high level. We have a really good website that has a lot of information about it, about what I've talked about, and many, many more things. And you can see the address there on the slide itself. We keep it up to date with anything that's happening with statute updates. You know, in about a month or so, we're going to be going into another legislative session, so hold on, there'll be changes coming up. We have training materials, we've got links and forms, but more importantly, we have the contact information. You can get to us, either email or give us a call. We're very good at giving calls back and that type of stuff. Christina talked about a little bit about you know, where you can find the MyRx report. We have a series of very short training videos that you can look and reference anytime. And again, if you want to register yourself, you want to register a delegate, if you want to learn more about using a patient report, but there's also a video on the MyRx report, how to get to it and how to read it and what to do when you find something that you need to act on. Okay, pretty good with time. Let's go ahead and take any questions. What I will tell you, again, is if you have any questions that maybe you don't want to propose but you want to send to me, there's my email address on the slide itself. I will attempt to answer as many questions as I can. Anything that I can't, I will definitely get back and to my compadres at the office. We'll talk about it, and we will get an answer out to everybody on the line. So, Christine, are there any questions?
Yes, Lynn. How are approved individual requests for a record sent?
So what would happen for individual records, patient record, is there's a form that you would fill out. You would download it and print it. You would fill it out. You would take that and you would have that notarized. And then you would make a copy of your valid government issued ID. And you can either send that in, and there is by snail mail, or you can fax it in. We do have our fax number on the web page. And you can also send it via email because we have a general email box. You can send that in as well.
Thank you, Lynn. One participant said they had sent one electronically and the pharmacy told the patient that it had to be in paper form. What should practitioners do in those types of situations?
So that is an interesting, not knowing more about the situation in regards to with EPCS coming up and that type of stuff. And I will tell you this, and I will come clean with you. I'm not a pharmacist. My only background with pharmacists was waiting in line, but I know that I have more respect for them now. You can reach out to the pharmacist and see what reason they had for not taking it. There's also, and of course, we want the patient to get the medication as quickly as possible, especially when we're talking about, controlled substances and that type of stuff. If the pharmacist is not, they might be able to even go to another pharmacist in the area if need be. If it's something that you see that it's a problem that's consistent, you can reach out to the pharmacy board and you can put a complaint in if need be. And you can do that on an email. There's an email address, or you can call us, and then we would look into that. But ultimately, it is the pharmacist's discretion whether they fill it or not. They don't have to fill it, if that makes sense. And unfortunately, that happens sometimes. So I don't know if that's a very clear answer or a good answer. It is something that happens, I don't want to say a lot, but it does happen, and I know we're all very busy when it comes to the medical field, but there are certain ways that are around it.
Do you feel that the pharmacists are aware about the upcoming mandate that is happening and that they should be receiving some types of education on how to accept those electronically, so a patient is not turned away from them in those situations, or say it has to be in a written form versus an electronic form, or they're saying we're not required to do it this way? Are you fielding calls from pharmacists that way, or
yes,
prescribers?
Yes, so we are fielding calls. We're working with Health Current on a big education push. We know there's going to be some growing pains. One thing, though, that there are, and Christine, you can maybe, there's 98% of pharmacies are actually EPCS compliant.
Yeah, Arizona is one of the leaders.
So one of the leaders. So that tells you that they know that it's coming down the road and they're prepared for it. The challenge that we see is twofold. Here, in like most states, but here in Arizona, you've got federal facilities, you've got the VAs, you've got the military health services, you have Indian health services. Those are federal facilities, and this is a state mandate. They don't have to follow it. And so we're trying to prep them as well. So if you receive a paper copy, and for the most part, you can probably see by where it's from that it's maybe from a VA. That's not a requirement for them for that Schedule II opioid to be in electronic form. There's also, we're trying to tell people that, we're talking about electronics. Christine and I, we dealt with this 30 minutes ago. Sometimes it doesn't work. And we're telling them, okay, system inoperable. Just write that on the hard copy. That lets the pharmacy know that they can fill that. And what we're hoping is that both prescribers and dispensers give a little bit, so ultimately the patients that need the medication get the medication that they need. So there's going to be some bumps in the road. We know that. We're trying to get the word out as much as possible. We field calls every day, and that's what we tell them.
Thank you, Lynn. Again, the chat feature is open. We're holding here for any other questions for Lynn Curtis. We do certainly thank him for coming in to our offices today to give us more education on the PMP process and the mandate that is coming effective January 1st of 2020. We will leave the chat line open. Lynn will stay with us if other folks have questions about that. But I'm going to now turn the presentation and pass the ball to our folks at Dr. First. We'll unmute Eric's line. Bear with me just a moment. Eric, are you with us?
I am here, and hopefully you can see my screen.
It joining us. Looks like you're going to be sharing content. I can see your screen. Again, our lines are muted, so if folks do have questions for Eric from Dr. First or from Lynn from his earlier presentation, please, again, feel free to use the chat feature, and we will answer those throughout the demonstration. Eric?
Perfect. Thank you. Hi, my name is Eric Zimpbaum. I'm with Dr. First. I'm actually located here in Arizona as well, so I know our pains with this upcoming mandate. Dr. First was one of the originals for e-prescribing, and we worked with the DEA in 2010 to do the whole EPCS part of that, and that's the ability to send controlled medications electronically. So that is why we are involved with this. I've been in healthcare IT for 11, 12 plus years, just to kind of give you a rough idea on who I am. And then later on, I'll share some contact information for myself and then my rep who also handles Arizona, so you know how to reach out to us with any questions. What I'm going to do is show you briefly, I'm going to run through a demonstration to show you what the web part of all of this looks like, which is what you're looking at now. I'll show you how you'll send a prescription, controlled medication, a couple of other kind of key features like pending a prescription, etc. What I'm going to start out with first, and I apologize, my demo for our app is not working the best. So what I have is I've got a 3-minute video here. I'm going to run the video. I'll speak to it. But this, at least more than anything, gives you a visual of how all of this stuff works, how you're going to send the prescription, etc. So I'm going to start that. Bear with me, let me enlarge it. So this, in fact, is the app. So this is what you would be using on your smart device. And it's going to run through some basic scenarios in here. It's pulling up the patient themselves. So you'll be able to load your patients in here. This connects with the web platform, so everybody will be in here automatically. You're going to search for patients, and then you can prescribe as seen. So we've got smart device, and there is smart signature, I should say. So you type in a medication, it will bring up a laundry list of all the meds for you, dosage amounts, and you're simply going to point and click as you see. You're going to do quantity, how to take the medication, etc. Like I say, it's very intuitive, and it's a lot of pointing and clicking in terms of using the product. Same on the web when we go onto that as well. So here it is showing that you can create favorites on the application part. If there's medications or dosage amounts you typically prescribe, you can create a favorite for that. This is showing one of our alerts. I'll show you this on the website as well. But let's say a drug-to-drug interaction alert, drug-to-diagnosis, etc. They will be on both systems. So the application, or I'm sorry, yeah, the app as well as the web. So here you can see the directions, and then you can build directions. So you can add items in there. And again, you can do that, like I say, this will be on the app and the web, but you can build how you want this prescription to look. And then you can enter quantity, if there are refills, etc. So you can enter all of that information in here. And then you do have some extra tools that essentially you can reach out to the patient to make sure that they did in fact get the prescription, ask them if there's any questions, etc. In this instance, it's showing how you would send the controlled medication. This is the 2-factor authentication. You're entering a passphrase and a token number. I'll provide an example of that on the web as well. Like I say, yeah, you can send the controlled medications from the app. This is now showing a start of a chat, reaching out to a patient, following up, did they get their prescription, is there any questions, etc. And now this is a timed device so that the conversation with the patient will end at some point. So you're not stuck receiving text messages and calls from them constantly. So anyway, that was really to provide an example of what the app looks like. It provides a lot of the same features and functions as the web service, but you can do it from the convenience of your phone. So the beauty of that as well, and I'll show you this as we go through it, is your staff can queue up and pen medications, and then you as the provider can actually go on. You don't have to be in the office. You could be across the country. They can do it from the website of things, and then you can go ahead and release these medications via your phone. So the flexibility is there. So here is the website of things. This is kind of the most common entrance, and I say that because you can have staff, administration, whomever actually work on this, and typically the workflow is staff, for the very least, will be working on the web side of it. And then if you need to release things and be on the go, the provider will then go into their app and do that. But a bulk of what you are doing in workflow is done on the computer and on the web login. Patient page, everything is on the same page. So we've got the patient information, pharmacies that they typically use, that will be logged in there. If you need to add a pharmacy, you can do so by simply pointing and clicking in a pharmacy search. We're going to provide formulary information. That is not for billing purposes, but that is to make you aware if the medication is covered by the insurance company. If not, we'll provide a generic alternative. And that kind of stuff just pops up right within the same page. Down here in the middle, this is all the patient medication. This is their medication history. So this is going to be from all the providers they're seeing. So we'll provide all the medications that they're taking. We are pulling this from a number of sources: pharmacies, insurance companies, the doctors using our system. We are the e-prescribing component in most of these EMRs and hospital systems. So we're grabbing this info from all over the place. And then there's people who use this as a standalone, and you just log into the product. So we're grabbing this info from everywhere. We are providing it in real time. So once you put the patient information in there, this instantly pops up. You can add allergies. You can add diagnosis. You don't have to, but it's at your discretion. You can add that kind of information. So that's what you're looking at. There's 3 ways to prescribe. I'll point those out, and show you what those look like. The most common probably is going to be, once the patient's in here and you've got medications, is renewing the medication. Now, you can see this is not necessarily the most correct in terms of Adderall and Xanax and oxycodone, but this is for demonstration purposes to really show you how you send a controlled medication. So what I'm going to do here is let me renew this Xanax medication. So I'm going to check mark that. I'm coming over here. I'm going to click the renew button. And now what's going to happen, here's an example of one of the alerts, a dosage alert. It's more of a heads up, make you aware. You can always prescribe anyway. So it's up to you, your discretion as the provider. I'm going to prescribe anyway. Here are some of the formulary information I said. So if it's not covered on formulary, it will provide you some alternatives. I'm going to prescribe anyway. We're going to stay on this same page, simply coming to the bottom, and now the medication is pending. So it is sitting there pending, and it will stay there indefinitely until you either prescribe it, cancel the prescription, whatever you would like to do. So kind of a common workflow is maybe staff sees the patient, they queue up the medication, and then the provider can have as little input as just releasing the controlled medication at a later time, whether it's at the top of the hour or however you'd like to create your workflow. So we've got our Xanax down here. I'm going to enter my signature password and click send. Now, if this was a non-controlled, alleged medication such as the amoxicillin, it will go straight to the pharmacy once I do that. However, since it's controlled medication, I've got to do an extra step, and this is probably what you have heard of. It's called the 2-factor authentication. So what I am going to do here is I'm going to enter my passphrase. Now this stays the same. You create this in the beginning. We walk you through this. You'll create whatever passphrase you like, and then you're going to enter a token number. We provide you a key fob, so you'll have a hard token. And what I'm actually doing now is because you'll have the capability of downloading this as an app on your phone. You can put it on a laptop. However, you can do it up to 5 devices. It's associated to your MPI number. So right at this moment, I'm getting the number 022999. I'm going to click sign, and it's now going to the pharmacy. And the prescription has left, and then I can go up to this line, and I can see and verify the date that, sorry, here, it was last written on 10/30. You can pull prescription reports so you can see who's sending what, and everything is timestamped. So it will not just show you the date, but it'll show you the exact time this was sent, the initials of whom sent it, etc. But that is how you're going to send a controlled medication, and that is the two-factor step in all of this. And I'll show you this again. I'll do another controlled medication. 2 other ways you can prescribe right here at the top. So I'm up here at the top with this star. I'll open this up, and you can create favorites. You can create it based on organization, your own personal favorites, and recent medications prescribed. So with this, it's the same idea. I'm going to point and click, and once I point and click, it will then queue up at the bottom of the screen. But for the sake of time, I know we're getting close. I'm going to just point that out, and then I will go into the third way to prescribe, which is creating a new prescription, show you what that looks like. And I'm going to use Adderall just because that is the easiest for me for my demo environment. But you can see I just type in the first few letters, and it will pull up a laundry list of the medications that, are spelled that way. So I'm going to take the immediate release Adderall. I'm just pointing and clicking on that. I've got the dosage amounts. It is letting me know the brand name is not formulary. However, they're generic alternatives. I'll click on the 20 milligram. This is what's going to take me to what's considered the signature screen. It's basically the same as the prescription pad. Here's the formulary alert I mentioned. And now we are on the signature screen. So same thing as the prescription pad here, basically. This is where you will create prescriptions. If you create a favorite, et cetera, you will do it from this screen. And then everything is located here in the drop downs. So we will say how we will take it. 1 tablet, let's say twice a day. You can put in directions to the patient. Take with food. You'll enter the quantity. Let's do 60 since I've done that before. And then you can type in directions to the pharmacist. So if there's specific directions to them, you can do it. You can do prescriptions ahead of time. So you can put a date sometime down the road. So for when it comes to insurance that they will pay a bulk amount, if you need to, you can do a 14-day supply, and then you can set up the next 14-day supply down the road and put a date in there. And we've got this information filled in. We'll review it, and then you'll see everything's nice and legible. It depends on the software, but this is all the info the pharmacy side is getting. It may not look exactly like this, but all of this information you see here in this border, they're getting this info. And then you can see the information that I typed in here shows up for the patient, directions to pharmacist, they show up. So from this screen, you can send the prescription. I am going to append it. This is going to bring us back to that main page, and then I'll show you again how you send the controlled medication. So we're back on that main patient page. I'm at the bottom now, and then I'm going to click send. So once you've actually sent a prescription for the day, you can just start going down there and clicking send. Kind of takes that extra click out for you, having to enter the signature password. So I'm going to enter my passphrase again. And then bear with me, I'm going to log into my phone. And I'm entering the 6-digit code it's giving me of 868264. I'm going to sign and send. I might get a duplicate therapy alert. So yes, it's letting me know that I have prescribed. I'm going to ignore and just send anyway. And then, oops, I apologize. I took it off my list, but I didn't check the other box. But the prescription gets sent. And the idea being that you could see how it was sent with the passphrase and token. And I apologize, I did not check mark the other box, but what it would do is it would keep it on this medication history report, and then it would be updated. I know we're up against it. Just two other quick items I want to point out. Up here, what you will get is this is pending prescriptions. So I can now go in here, and I've got 54 pending prescriptions. So I can now, as the provider, go in there and release these prescriptions. Non-controlled you can do as bulk. Controlled medication, you will have to go through each one because it will have to have a token number assigned to it. However, if you've got a patient that you're doing multiple controlled medications for, you can send those in bulk. And then for the non-controlled, even though I know the mandate is geared towards controlled medications, but using the system overall, here is refill requests. So the pharmacy can send a renewal or refill request directly from the pharmacy. It comes over electronically, and then you can acknowledge that. You can say yes, you can reject it, etc. So you don't have to necessarily accept it. And then there's other stuff in here like e-prior authorization, my benefit check, so you can actually, pharmacies the patients go to and the price of the medications, and we'll give you a list so you can steer them where it might be least expensive, all sorts of stuff in the software for that kind of thing. So anyway, that gives you an idea of how you send the prescriptions, what it looks like, very general. And what I will do, and we can answer questions, don't laugh at my very generic slide, but this gives you my contact information. And then to confuse it more, Eric Shark, who is my Arizona rep, his contact info, and you can reach out to us directly for questions.
Thank you so much, Eric. The chat box is open. I don't have any questions yet rolling in, but folks may be typing as we are kind of waiting for those to happen. We are just a few minutes past the 1 o'clock hour, so again, thank you, Eric, for giving us the Dr. First demo today, and again to Lynn Curtis for sharing all of the ins and outs to be compliant with the EPCS program and campaign that is currently going on. Again, today's presentation was recorded. So for those of you that may have had other colleagues that couldn't join today, please visit the Health Current website under EPCS or e-prescribing. You can download not only the presentation, but today's recording. Just a reminder that today's recording will be available, as well as the presentation sent out to all of those participating. Again, we're holding for any questions in the chat box. So far, none have come through yet, Eric, but maybe you've done such a great job, you've answered all their questions.
Hey, that sounds good, but I'm here. And then, like I say, email us as well. That's fine.
Wonderful. Well, again, I'm not seeing any questions coming through, and we are going to then go ahead and conclude today's webinar. Thank you again for all of you who have taken time out of your lunch schedule to be a part of this. Thank you to Lynn Curtis and Eric Zimbaum for joining us today. Again, their email addresses are also contained, and their telephone numbers within each of the slide decks. We'll get those out to everyone later today or tomorrow. Thank you again, both. Thank you again to everyone on the line today. Have a wonderful day. Thank you.
Thanks, everyone.
Thank you.